Well, good afternoon and welcome to our virtual Dialogue with the Dean, bringing you more from the Purdue campus and some updates from the college. Before we start, I do want to just remind everyone that if you have any questions throughout this video, please feel free to leave a comment and we'll come back and we'll be responding to your questions. Today we have with us Dr. Jasmine Gonzalvo. Dr. Gonzalvo is a clinical professor for the College of Pharmacy, and she's the director of the Center for Health Equity and Innovation here in the college. Jasmine, thank you for being with us today.
Happy to be here.
Great. Well, we're really excited to be able to share and allow you to share some of the work that you and your colleagues have been doing in the Center for Health Equity and Innovation over the last year. We call it CHEqI. So if we say CHEqI, everyone knows what we're talking about. So the Center for Health Equity and Innovation has been around, again, as I just said, for just over a year. So why don't you tell us a little bit about why the center was established?
Sure. In general, we started off with conversations just about really how we could envision Purdue and the College of Pharmacy in particular making an impact on health disparities and with a focus on health equity, social determinants of health. And so really with that vision, our conversations led us to developing the Center for Health Equity and Innovation. And in our first year, we've made incredible progress, substantial progress in a number of different areas. So I've been excited from the very outset, and with your support and with the support of Dr. Alan Zillick as well, our department head, and from a number of people across the university and external stakeholders as well, the center has really had an amazing first year making progress towards eliminating health disparities.
So why don't you share just a little bit with the folks that are listening on some of your recent initiatives that you and your team have worked on?
Yeah, I think a fantastic place to start is just the work that we have been involved with our students. And we have a CHEqI student group, and we are interdisciplinary. So of course, pharmacy students, but also public health and communication and engineering. We have a fantastic group of interdisciplinary students who are compassionate and engaged in our health equity projects. And it's amazing the ideas that they come up with, and it's amazing the energy that they bring to our work. And so that is one of the projects that I'm incredibly excited about with CHEqI, and seeing and working with these amazing students who are doing incredible work so early on in their professional careers, that that's one of the things that really keeps me excited and engaged, is just seeing and working with the students. And secondly, we've engaged faculty from across the university. So interdisciplinary faculty from different colleges and schools to engage a number of different communities. We have projects and work going on in, for example, the LGBTQ community, Black, Latinx communities, and a number of different stages along the way, but we do have concentrated efforts in those communities. We also do work with individuals who are experiencing homelessness. And so we have a broad range of health disparities that we cover through our work with the center. And lastly, I would also say that we aren't just focused in Indiana. While we have a lot of work going on in Indiana, we also have work going on nationally and even internationally. And so this is kind of what I mentioned earlier with the substantial progress that we've made throughout the first year. We're spanning a lot of different marginalized communities, and feel that we're helping a lot of people, supporting a lot of people, and contributing to the evidence base to, again, eliminate health disparities and support the social determinants of health.
There are several pharmacy alumni that are helping with the center. What are they doing, and how can other alumni get involved?
Oh, goodness, the alumni have been fantastic. And one of the ways that we've engaged the alumni is really having them engage with our students. And what we've asked them to do really is give presentations on how their time at Purdue led them to a career in health equity, or describing their work and passion and commitment for health equity and health disparities. And so we have had fantastic conversations with so many alumni just who already have made such an impact in health equity, and getting them re-engaged through CHEqI and through the center, and having them pass along their message to the students, engage with the students, and also offer opportunities for the students to get engaged with their work, whether that be through internships or volunteer work or really just mentorship. I think alumni have been fantastic to work with the center on our early initiatives, and we're excited to see how we can also partner in different ways or innovative ways with different alumni from across the university.
Well, it's really exciting to see this work. It's hard to believe it's only been a year, and it's obviously a year that's been challenged by the pandemic as well. And so great work that's going on. And I know our alumni and our students are going to be real excited to see where this goes in the years ahead. Maybe you've got a question for me. That's usually what we do on our dialogue with the dean, and maybe something you're wondering.
Do.
Yeah.
I do. I just think from your perspective, it would be good to hear why it's important for the College of Pharmacy to prioritize health equity initiatives.
Well, I think a couple of things. One, there's growing interest on the Purdue campus as a whole in the health equity space. And so I'm really pleased that you expressed an interest in this specific area just a year and a half ago, that we began to think more deeply about it. And I think we were a little bit ahead of the conversation on campus. And I think it really is an opportunity for the college to be a leader on campus in health equity. And so I think that's really important. But more so, I think, as we think about who we are as a university, as a college, where we're located, that this is a place where we can make impact. That we have an opportunity in rural health, which is its own space, and then comparing that to the urban health challenges. And in Indianapolis, we have those opportunities to impact both rural and urban health as it relates to health equity. Certainly, we've got expertise, and there's a lot of interest between yourself and many of your team members who've been thinking about health equity. And so I think really it's an intersection for us between the expertise we have, the passions that you have, that many of our other faculty, staff, and certainly our students and alumni have. And so when those things align, it really does give us a chance to have the kind of impact that we hope to have in healthcare. Lastly, I think it really does align, the health equity space aligns with our mission as a land-grant university, which is for us to make a difference in our communities. We educate, students, but beyond that, we are engaged with our communities to have impact. And for the College of Pharmacy, I think this is a real space for us to make a difference in the state of Indiana and beyond. And so I'm real excited, and I'm about the center, and really look forward to seeing how things continue to develop under your leadership. So thank you for all that you're doing, and we look forward to seeing how things go forward in the future.
Perfect. Thank you.
Well, as always, please feel free to comment on this video if you have questions, or if there are other topics that you'd like to see us discuss in the future. As always, thanks for watching. Hail Purdue, and boiler up.